We're now joined by Dr. Taryn Morrisey, professor at the School of Public Affairs at American University. Good to see you, Dr. Morrisey.
Thanks so much for having me.
You got it. This is part of an ongoing series of programs we're doing around childcare. As part of our Reimagine Childcare initiative, you'll see the website up. A report that was done, you're the co-author of a report released late in 2021 called Pennies to the Dollar, the Investment Gap for New Jersey's Earliest Learners. Key findings include?
Well, thank you. Yes, as my collaborator, AJ Chaudhry, and I detail in the report, New Jersey spends about $680 per year in state and federal funds in education and care for each child under age 3, so infants and toddlers. And this is in 2019. So $680 per child. Compare this to about $22,000 per child aged 5 to 18, right, in K through 12 education, and about $8,000 per child in age 3 to 4. And New Jersey has really strong K through 12 schools and an evidence-based preschool program, but there's no universal system or really anything like it for infants and toddlers.
Okay, I want to follow up on this. But you also in the report talk extensively about the child care workforce, wages, turnover. They're just not getting paid. Those professionals in child care organizations just aren't getting paid enough. Is that the biggest part of the reason why we're losing those folks and there's so much turnover, Doctor?
I think so. I mean, in May of 2021, the median wage for childcare workers in New Jersey was about $14 an hour. And anybody living in the state or nearby knows how expensive it is. And nationally, it's $13 per hour. It's simply often not enough to live. About half of childcare workers are eligible for or receiving public assistance because they earn so little. We know nationally only about 16% or 16%, excuse me, of childcare workers lack health insurance. And it leads to staff turnover, as you were saying, which is a big problem for young children who are trying to build relationships with their adult caregivers and parents who need reliable childcare to work.
Not to mention keeping those childcare centers open if they don't have enough professionals to work there.
That's exactly right. The low compensation makes recruiting and retaining a skilled workforce really difficult. And many programs have empty classrooms that they can't staff. And meanwhile, parents are struggling to find and afford childcare.
Taryn, talk a little bit about the economic impact. Some people might say, oh yeah, I think we should have better childcare. That would be nice if it was more accessible and affordable and good quality, but it's not an economic issue. It absolutely is an economic issue. Talk about it.
It absolutely is an economic issue, and in 3 ways. I mean, one, at the very basic level, childcare allows parents to work. I have 2 children, ages 5 and 8, and they're currently at summer camp, is allowing me to work. Second, childcare is in a vital employment sector in its own right. We were just talking about the childcare workforce. Now it's arguably too low compensated. We need to increase compensation, but it employs millions of people across the country and allows other people to work. And then finally, high quality settings promote the workforce of the future. We know that developmentally appropriate, high quality settings, curricula, interactions with adults promote children's short and long-term educational and economic outcomes.
Let's talk about federal dollars here. So a lot of federal money, billions and billions of dollars, federal money connected to COVID relief. To what degree have those dollars, particularly with the American Rescue Plan, to what degree did those dollars gone toward the child care crisis?
Billions of dollars have been invested in the childcare crisis, and it's necessary. I mean, these problems have pre-existed the pandemic, but the pandemic has exacerbated families' struggles in finding and affording childcare, and in childcare programs struggling to stay open. The economics of childcare are difficult in that the quality depends on the interaction between the adult and the child, and that requires small child to adult ratios, which means that labor is a big expense. Now, We know that compensation is low, right? Because parents are paying as much or more than they can afford. And it makes childcare profit margins really, really small. And so you throw in a crisis like the pandemic, when public health measures are expensive, when enrollment goes down, and childcare programs have a really hard time staying open. So those federal relief dollars were essential to keeping the childcare sector going and to keeping the economy going. Much of our workforce are parents who need this childcare to work, especially with when schools are closed, but this continues. So those relief dollars were essential for paying rent, paying utilities, and paying personnel, and allowing programs to reopen or stay open.
Okay, so let's go through this, the findings of the study. And P.S., if we put up the website at American University, more specifically the School of Public Affairs, is the report accessible to people?
Yes, the report is accessible actually on ACNJ's website, the Advocates for Children of New Jersey website.
So let me try this. So if we're talking about substantive, specific policy changes that need to be made to have a stable, stronger childcare system, paying workers more, providing more direct subsidies to parents of children, particularly those who qualify from an economic perspective, and what else? Give me a couple of other policy actions, policy decisions that need to be made and move forward on and implemented, please.
Those are the big ones. I mean, expanding childcare assistance to families across the income spectrum up to moderate income families would do a lot to help families afford.
Sorry, doctor, is it too low right now? Is the threshold too low right now?
It is. And I know there's well, right now it's up to about 85% of state median income, but only 18% of eligible infants and toddlers right now in New Jersey actually receive help, so receive subsidies.
That's it,
We're
18%.
not even,
wow.
That's 4% of New Jersey's infants and toddlers. So we're not even serving the children who are eligible, and we need to raise that eligibility. I know there's proposals in New Jersey being debated up to 300% of the federal poverty level,
That's
for
right.
example. The quality really rests on that interaction and that warmth, the responsiveness between caregivers and teachers and children. And so we know that children's outcomes flourish, in the short term and the long term when we have that quality. And providers need to be compensated fairly for their education and their experience. And so rewarding individuals for getting more credentials, for experience, and preventing them from moving to the K through 12 sector or the preschool sector where they will get paid more.
To what degree do you believe that a significant number of policymakers in elected and appointed office, particularly those who are men, are getting this, understanding it, and acting on it? I know it's a loaded question, 30 seconds or less.
I'm not a political scientist, I'm a developmental psychologist, but I will say, just from my 20 years in the field, that I do see people understanding the field more. I see my college students, male and female alike, understanding and getting excited about child and family policy and recognizing that the economy is simply not going to sustain itself with a workforce that can't get to work and stay at work. And we need to provide fair jobs for the disproportionate, for the workforce in childcare that's disproportionately female and disproportionately women of color. And we need to set our children up for future success. So we've made strides, but we still have a lot of work to do in supporting the youngest among us.
Well said, and that is why we're involved in a public awareness campaign called Reimagine Childcare. Dr. Taryn Morrisey, professor at the School of Public Affairs at American University. Thank you so much, doctor. Appreciate it.
Thank you for having me.
You got it. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare. Johnson & Johnson, University Hospital, NJM Insurance Group, Bank of America, the Port Authority of New York and New Jersey, New Jersey Sharing Network, the New Jersey Economic Development Authority, and by New Jersey's Clean Energy Program. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by the New Jersey Business and Industry Association.
Nurses, you rise to the challenge every day. We see you and stand with you. Your scientists, healers, rock star nurses. You give 100%, then find 50% more. For health systems to work, it takes nurses. And for 125 years, we've championed your innovation and grit. And like you, we'll never stop.